It's wonderful to have Lynn Kachuik on the couch with me this morning. She is the newest and the first recipient of the Boehringer Ingelheim Oncology Nurse of the Year Award. Congratulations.
Thank you very much.
I should also mention that you're one of the nominated people for the 25 most amazing people here, which is a wonderful gala happening later on in the month. This was a wonderful award, first time, and it was it was given out to you at a wonderful conference that actually happened here in Ottawa.
Yes, we had the Canadian Association of Nurses in Oncology conference here in Ottawa from Wednesday till Sunday. We had 487 nurses from across Canada, including even 2 nurses from Nunavut that our local chapter fundraised to bring them down because we provide care for those people here in Ottawa.
And that was a wonderful initiative for you to be able to bring these nurses in for that as well, which is part of your story. There was quite the whirlwind as to how you actually got into oncology, because originally you were a teacher. And then life had its moments and had some tragedy, and it got you into nursing.
That's correct. We had 3 children, and our middle son, Jeffrey, died when he was 6 of kidney disease, actually. And our whole family received such wonderful care when we were in Kingston that I was inspired to go into nursing. I had planned on doing it once he was transplanted. And after he died, we had been posted here. We'd chosen to come here because of CHEO. My husband was in the military. And so I went back to school when I got here and wrote my Canadian nursing exams, and then we were posted to Colorado. And we drove across. I wrote my American boards and began doing pediatric hematology oncology in Colorado.
What was that experience like?
It was amazing. I really enjoyed working in pediatrics. I felt I had a real affinity for the parents. I could help them kind of get through things because I had actually walked some of their walk, not all of it. And when we came back here to Ottawa, then I got into adult oncology because there was nothing available in pediatrics, and I've stayed in the field ever since.
You've stayed in the field, and at the same time, you've mentored so many other people. There's the education aspect here. You've really gone through a lot of different roles within nursing that really encompass everything of who you are.
That's right. I've been able to do clinical nursing, be a clinical educator to educate other nurses coming in, also doing research and managing the inpatient oncology unit at the Civic prior to the hospital amalgamation. And now I'm in an advanced practice role, which encompasses all of those roles.
As soon as I saw oncology, I said that takes a certain individual, because there's got to be an amazing, there's highs and lows. What do you enjoy about, heading to work every day and being in the midst of joy and happiness and difficult times for the patients and the families?
It's all about the patient and the family and putting them at the center. And truly, nurses are the pivot of the team. They're the ones that are there 24/7, and they provide that leadership and advocate for patients and what they need. One story that was just presented at this conference that I was involved in was we had a nursing student who was diagnosed with a sarcoma, and unfortunately she succumbed to that illness after about a year. But in her last few weeks, one of the things she wanted was to get her degree. And so we were able to, one of the nurses on the unit approached the university, and they actually came and granted her degree, cap and gown, pinned her. Wow. And although it's a sad story, that was the last thing on her bucket list, so we were able to do that for her.
And I think it inspires the rest of you nurses to understand what it is why people want to be in this job and the work that they do. Congratulations, by the way. I'm sorry that we've run out of time, but congratulations on winning the first ever Oncology Nurse of the Year award, and thank you for the work that it is that you do and so many thousands of others. Thank you.
Thank you.